19. Right now, 38 degrees on your severe weather station, 1480 WHBC. Well, here we are on a Wednesday morning. That means time for our office visit with Dr. Stan Anderson. Good morning, Dr. Stan.
Hey, Pam, great to talk to you.
You as well, sir. And we were talking about the flu and all that kind of stuff last week, and mentioned that we wanted to talk about the changes to the vaccination schedule. So fill us in on what these changes are.
Yeah, so the first thing is the changes have brought about such an amount of fury and anger in the medical community because doctors and medical people don't like change. So, so on one hand, I'm going to simply tell you that the changes that are recommendation, that's the number of universal immunizations, dropped from 17 to 11. So what they're basically saying is no change to getting the chickenpox, to the tetanus, to the hepatitis B, to getting the measles, mumps, rubella, which everybody says that's the one that causes the autism. That's the one that causes everything. There's been no change to it. They're not changing anything with pneumococcal disease or polio or human papillomavirus. They're not changing those recommendations. The recommendations are shared decision making. So what that means is that instead of everybody gets this universally, you talk it over with the parents and your healthcare provider. Should they get the COVID shot? Should they get the children, that is? Should they get the influenza shot? Should they get the rotavirus? Should they get the hepatitis A, hepatitis B, the meningitis, and then finally the RSV? So I did a little bit of research just to try to find out, okay, so take hepatitis A. You probably don't hear about hepatitis A because it's not that common. Last year, for instance, there were a total of 1,648, according to the CDC, a total of 1,648 cases, and there were a total of 85 deaths. So hepatitis A is not a huge disease thing. No, what happens is that when there's an outbreak, it tends to then spread quickly. And yes, people with lung disease, people with cancer, children that end up having transplants, they're going to be at an increased risk. So everything boils down to shared decision making. And the agency making that recommendation basically puts vaccines into three categories: those that are universally recommended, vaccines that are high risk groups, and vaccines that are recommended on shared decision making. And the issue is that almost every family physician, almost every pediatrician is still going to have all of the immunizations at their offices. The concern is that going to be down the road, will insurances cover getting all of the immunizations if the incidence of the infection is so negligible? And again, the key is thinking about hepatitis A. When I did the research to try to find out how many total cases there were, it's really not that many. So should we really vaccinate every single child when there were a total of 85 deaths, and almost every death was in a child that ended up having some other medical problem? So as a result, moving the immunizations to these are the ones that are definite, these are the ones that are if you have an increased risk. So yeah, if your child has had heart disease, has lung disease, you really need to get every single immunization that's available. You don't want to take that risk because your child is at an increased risk of a bad outcome. You don't want that. The final thing is shared decision making. And quite frankly, if you are anxious about immunizations, what this does, this gives you a little bit more leeway so that you can say, I don't know if I want my child immunized against, say, rotavirus, if you really know that the total number of rotavirus infections was a total of 2,000, and so it really isn't going to be that much of an issue. The reason that doctors are so upset about this is because those of us that are old enough to remember the years before we had immunizations, that's when those infections were dramatically higher. So the reason that most doctors are against this is because we're afraid that we're going to go back to those days. So the short answer is, one, if you want your child to get the immunizations, you can get every one of them. Every insurance company has said that for at least the next year, probably 2 years, they are going to continue to cover every single immunization. The question is going to be, what is the impact that this will be on 2 years from now, 3 years from now? Will insurance companies continue to cover it if it is not an official guideline recommendation? That's where the big controversy is, and I will be concerned if we start to have outbreaks. So what we do is we look at the communities that routinely don't get immunizations. So normally what we do is we look at the Amish, and we answer the question, do the Amish have rotavirus infections? Do they have hepatitis A? Do they have B? Meningitis? Do they have much influenza? Do they have much COVID? And the downside is that the Amish community was actually hit harder than the rest of society because they chose not to get many of those immunizations. So using the Amish as, say, a template, what I would say is it'll be really interesting to see the direction that things go. It all boils down to money. I mean, I hate to sound crass, but it kind of boils down to that as to if insurances are going to cover it, most parents are going to have their child get it. If the insurance doesn't cover it, most parents are not going to get it. And the question is going to be, what is going to be the impact in the future? Is it going to go back to the way in which it was in the past? And then we're going to end up having not just 1,600 cases, but 100,000 cases. That is waiting to be seen. We just don't know. So I'm kind of confusing, and I don't mean to drone on. I hope I'm not boring everyone.
No.
My intention is just to say, this is what is going to change. For now, it simply allows people that don't want it, they can take that side.
Yeah, I mean, and that makes a lot of people happy, or some people happy, and feel more comfortable. But I guess always thought like, okay, this was something that I could talk with my doctor about, and hopefully people will continue to do that. So,
yeah, and that is so important. Keep that line of communication because your provider is going to be your best source of information for you.
Yeah, they know you the best, so that's a good thing. All right,
Very
Dr.
true.
Stan, you laid it out perfectly. That was awesome, and we'll chat again next Wednesday.
Hey, I look forward to it.